This will be an overview of the eligibility of people accessing the different housing assistance resources within coordinated access and what those housing assistance resources are in Multnomah County. This training is for service providers who are authorized to utilize the VSBADAT for the Adult Coordinated Access System and the Family Coordinated Access System. If you do not know if you are authorized, please check with your supervisor or the Joint Office of Homeless Services. The Joint Office oversees the systems for domestic violence and the homeless youth continuum, in addition to the adult and family systems we will be discussing today, but neither of these two systems use the VSBADAT process. HUD has very specific definitions about what and who is eligible for funding. When working with folks to assess that they are eligible for coordinated access, there are a few main definitions that are going to be important moving forward. Housing first, disabling condition, homeless, chronic homeless status, and dedicated plus. HUD's exact language about Housing First program states, recipients that are provided permanent supportive housing for hard-to-house populations of homeless persons must exercise judgment and examine all circumstances in determining whether termination is appropriate. Under this interim rule, HUD has determined that a participant's assistance should be terminated only in the most severe cases. While not all of our projects are HUD funded, our community has agreed to practice a Housing First model, therefore choosing to reduce barriers for those most impacted by being unhoused. The Joint Office of Homeless Services is dedicated to ensuring programs are following this community agreement in order to provide equitable housing and services. Housing First programming looks like the following. Projects move quickly to help participants into permanent housing. Projects ensure participants are not screened out based on the following items: having too little income, active or a history of substance use, having a criminal record, with exceptions for state-mandated restrictions, a history of victimization such as domestic violence, sexual assault, or childhood abuse. Projects also ensure that participants are not terminated from the program for the following reasons: a failure to participate in supportive services. This does not include case management that is for the purposes of engagement only. Failure to make progress on a service plan. The loss of income or failure to improve income. Any other activity not covered in a lease agreement typically found in the project's geographic area. There are a lot of great tools on HUD's website that help provide programs guidance in ensuring that they are following this. The reason that this is important as a VSBADAT assessor is that we must not make judgments of statements given by those being assessed. It is not our job as assessors to determine which housing is appropriate or if a person is ready or not for housing. As assessors, we are only there to reduce barriers to accessing housing, demystify the assessment process, record the self-reported information we are provided with context, and if appropriate, offer resources that could be helpful between the time the assessment is complete and housing becomes available. The Housing First model guarantees that everybody is housing ready. All folks accessing HUD-funded housing money must have a verifiable disabling condition. However, it is not the job of the assessor to determine at the time of assessment if this disability or any reported information is verifiable. The VSBADAT is completely self-reported, so if someone says they have a disabling condition, the assessor records that they have a disabling condition. Remembering, though, that part of your job as an assessor is to try to get the most complete picture of a person's situation by reducing barriers and demystifying the assessment process. It is okay to provide context and suggestions. For example, if you know someone has a disabling condition and they do not self-report it, it is okay to ask leading questions. This might sound like, I noticed that you use a cane sometimes. Does this feel like it could count towards a disabling condition? Or, I remember in our conversation last week that you mentioned being able to see things that other people don't always see. Do you think maybe this counts towards having a mental health condition? These prompts help people more accurately capture their reality while being person-centered, trauma-informed, and respectful of their autonomy. Whatever that person reports, however, is what gets reported on the VSBADAT, regardless of how accurate it feels to the assessor. Once a person gets referred off the queue, the disability must be documented by a qualified professional. This definition is very different from what Social Security or the disability department use to determine disabling condition. HUD's definition is broader in definition, but it is still specific and requires documentation. HUD defines disabling condition as having one of the following: a physical, mental, or emotional impairment, including impairment caused by alcohol or drug abuse, post-traumatic stress disorder, or a brain injury that is expected to be of long, continuing, or indefinite duration, and substantially impedes the person's ability to live independently, and could be improved with stable housing. It can also be a developmental disability or a diagnosis of HIV or AIDS. Homelessness in general for HUD is defined as being literally homeless. The family system, which uses local non-HUD dollars to fund short-term housing subsidies, also allows for additional definitions. The family system, which is mostly rapid rehousing, allows for being doubled up or couch surfing, being street homeless, living in a vehicle, staying in a shelter, or less than 90 days in an institution that when they entered, they were in one of the other places not meant for habitation. The adult system defines homelessness as staying in a shelter or being street homeless, living in a vehicle, or in an institution for less than 90 days that when they entered, they were in one of the other places not meant for habitation. The adult system, because it is mostly funded with federal HUD money for permanent supportive housing, requires some of its referrals to be chronically homeless, which is defined as having been consistently unhoused without a break in homelessness for 12 months in a row or having 4 instances of being housed and then unhoused in the last 3 years. A break in homelessness is defined as 7 nights or more inside or 90 days or more in an institution. Chronic homelessness, per HUD's definition, means a person living in a place not meant for human habitation, a safe haven, which we do not have in Portland, or an emergency shelter, and that they have been residing in one of these situations for 12 months consecutively without any breaks in homelessness, or they have been living in one of those situations for the last 3 years with 4 or more separate occasions of breaks in homelessness, and they have a disabling condition, such as substance use disorder, a serious mental illness, developmental disability, PTSD, cognitive impairments resulting from a traumatic brain injury, or chronic physical illness or disability. Or an individual has been residing in an institution or care facility, including jail, substance abuse or mental health treatment facility, a hospital, or other similar facility for fewer than 90 days and has met all of the criteria before entering that facility. Or a family with an adult head of household who meets all of the criteria of this definition, including a family whose composition has fluctuated while the head of household has been homeless. Additionally, while someone is in rapid rehousing programs, meaning that an agency is paying for their housing, they retain their chronic homeless status they had before they entered that program. Some other things to be aware of as we discuss the definition of chronic homelessness. Staying in an institution, such as a jail, inpatient treatment, care facility, or hospital, for more than 90 days means a person loses their homelessness status. This could mean that a person who has a medical condition and chooses to seek care and is admitted to a hospital 89 days is still eligible and is considered homeless, but a person who has been in care for 91 days is no longer eligible and no longer considered homeless. The caveat here, though, is that as soon as someone returns to homelessness, their time in an institution counts as simply a break in homelessness. This can get complicated and confusing. For the purposes of completing the VISPEDAT, you do not have to verify any of this. This is just important background information for you to know moving forward. As you move forward with this process, check in with other people in your agency that have already had practice with this. If you're needing extra support, please reach out to the Joint Office Coordinated Access Team. Dedicated Plus expands the 2011 chronic homeless requirement for permanent supportive housing funded through the Continuum of Care to allow more people to access it. Programs were given the option to remain 100% dedicated, which would be maintaining the chronic homeless definition we just reviewed, or moving to a Dedicated Plus option, thereby expanding the definition of homelessness. Dedicated Plus programs expand the homeless definition to include chronically homeless, residing in a place not meant for human habitation, emergency shelter or safe haven for 12 months out of the last 3 years, regardless of the number of breaks in homelessness, and someone who has been admitted and enrolled in permanent housing projects within the last year and were unable to maintain housing placement and is now residing in a place not meant for human habitation, an emergency shelter, or a safe haven. If they were chronically homeless at the time that they entered a veterans program through the VA, they can also retain their chronic homeless status. This model gives more flexibility to programs to provide support to folks who cannot always document their unhoused situation. You won't know during the assessment what project a person is eligible for necessarily, but knowing the resources can help you better advocate for them by gathering context of their lived experience. Once case conferencing takes place, if a person comes up on the list, we will better be able to match them to a project that works for them, especially if we have this type of context. Let's talk a little bit about what the resources for housing look like. Coordinated Access for Adults in Portland area incorporates about 25% of all permanent supportive housing programming in the county. Coordinated Access for Families provides primarily rapid rehousing funds and a few permanent supportive housing. That still leaves a lot of other options outside this system. Within Coordinated Access, there are 3 types of housing services which we will review. Rapid rehousing, sometimes referred to as RRH, permanent supportive housing, PSH, and recovery-oriented transitional housing. Rapid rehousing, also referred to as RRH, provides short-term rental support. Rapid rehousing programs usually have some discretionary funds to assist in overcoming barriers to housing quickly. This type of programming is ideal for folks that have consistent income that will cover all of their expenses within a short amount of time, but is open to anyone who meets the criteria of being HUD homeless. The eligibility for HUD-funded rapid rehousing is different than the eligibility for locally funded rapid rehousing. The eligibility for HUD-funded rapid rehousing looks for the HUD definition of homelessness, whereas the eligibility for locally funded rapid rehousing is broader in definition. Permanent supportive housing, also referred to as PSH, is a long-term permanent subsidy provided to folks needing higher levels of support to maintain their housing. All PSH that goes through Coordinated Access is HUD-funded, and therefore we have to follow HUD's guidelines. People that qualify for PSH are chronically homeless and have a disabling condition. Currently, there are very limited funds for PSH in the family system. The last housing resource we're going to discuss in this training module is recovery-oriented transitional housing, also known as ROTH. This type of housing is designed for people who are in recovery from chemical or alcohol dependency who are seeking this type of sober living. It is short-term, lasting 4 to 24 months, and is site-based, meaning that the funding stays with the unit and not the person. All ROTH is alcohol and drug-free housing. The requirements to get into this program include the HUD definition of homelessness, and it is best for folks that are earlier on in their recovery. This is an option for housing that doesn't work for everyone, even if they are sober. Folks in ROTH housing are required to be sober, which means their housing quite literally depends on their ability to abstain. ROTH housing is intended for people who express a preference for recovery-oriented housing. There are other options if this is not what somebody is seeking. That was a lot of information. That's why we decided to record it, so you can refer back to the slideshow whenever you're feeling you need to. We also know that we couldn't possibly remember and answer everyone's questions, so we thought we'd give you some guidance on where else you might find some answers. Check in with your coworkers. Many people have gone through the assessment training and have experience doing different parts of the process. Use the expertise that exists in your agency. Check out the Coordinated Access website. The website has the most up-to-date ROIs, guides, assessments, and news about a home for everyone. Check out the interim rule on HUD's website. It's super long and full of words that can be frustrating, but it is also the final rule when it comes to what we can and can't do with HUD money. If you need help interpreting what the HUD rules look like for the interim rule, feel free to reach out to the Coordinated Access team. You're always welcome to email us, call us, and problem solve with us. Thank you so much for the work you do for our community.